Hi, everybody. Good morning. Dr. Stephen Mulholland is here of SpaMedica. He's a cosmetic and plastic surgeon. Nice to see you.
Nice to see you, Liz.
Thanks for coming to see us again. Now, we've got all sorts of questions here, so we'll get right to them on cosmetic surgery, on the injections, everything else. So first, this is from Kelly in Oakville. I recently lost a lot of weight and now have flab in the abdomen area and inner thighs. Is there any way to firm those areas by working out, or will I have to get it removed via liposuction?
Once you've lost weight, and it's good to keep your weight under control for health reasons, if you've got extra skin, it's extraordinarily hard, if not impossible, to tone the skin by making your muscles stronger.
Right.
That's the reality. And so if your skin's really, really, really loose, sometimes you need to remove some of that, and that's cosmetic surgery.
Right.
If it's just a little bit loose, we've got some new treatments now, different lasers and radio frequency electrical energy that can tighten and firm your skin.
Okay, and we have to talk about this lipo light, because are you the only person in Toronto or in Canada that does it?
I spent about 9 months working on this, and you'll see it more and more, but it's extraordinarily exciting because we've got so much for the face: Botox, injectable fillers, photofacials, skin treatments. We've got a lot we can do for the face without a knife, but for the body, all we really had was recommendations like candlelight and dimmers and loose-fitting clothes.
Exactly. But it's essentially something that melts fat, the lipo light, and helps to reduce cellulite. And I don't know if well, I know maybe a couple women who don't have cellulite. Who I don't hang around with very much. Otherwise, it's a horrible problem.
I think it's about 70% of women over 50, by the age of 50, and 50% by the age of 30 have some degree of cellulite. So what this does is it takes external energy, radio frequency current, and infrared laser-like energy, and treats it through the skin, melting the fat a bit like butter and smoothing the cellulite. And so this is poised to replace a lot of the small and modest liposuction procedures that patients have.
So if you can do that, I know we have something going on outside.
Someone really wants it done.
Kevin will pay attention. Yeah, really. Kevin will get on that and tell us what's going on in a minute. So the inches will go away. The fat melts like butter, but where does it go?
Good question. And when you do this over 8 weeks, all we're really doing is using heat to stimulate normal metabolic fat reduction, as you would when you restrict. So when you caloric restrict your body, you shrink fat all over. The problem is women often are disproportionate. The lower body's bigger than the upper.
Yeah.
We can take this and use heat to cause localized weight loss, safe, predictable weight loss, in localized frustrating areas: outer thigh, inner thigh, tummy, and hips, the most common.
That's going to be a popular one.
It is going to be very popular.
No doubt about it. Okay, I recently lost 35 pounds and am still on a weight loss plan to lose another 20. Before I started my weight loss, my bra size was 44 double D. I am wondering what is the best procedure to do after this loss. Would it be implants or a lift? This is somewhat like that's a huge area of skin that's going to be drooping. So what can she do?
Well, women suffer from 2 types of issues: weight loss and pregnancy, breastfeeding, and then postpartum. And after those 2 scenarios, your breasts often are like a balloon. The air comes out of them, and then it's either remove a little bit of the skin to lift, if you like the volume, add a breast implant, lift the skin, or push-up underwire bras, exercise, build up your pec muscles, and do it naturally.
I've heard that women can get Botox injected there now, and that will tighten and lift a little. Is that true?
The Botox actually is injected into your chest muscle, so it relaxes. So all you do is throw your shoulder backs. Now, that's pretty expensive Botox. Just have a nice posture.
Oh, really? And it'll do the same thing?
Yeah.
Okay. All right, these are a lot of breast questions. I had a breast reduction done in December of last year. I did get an infection at the T-site and have triangular scars there. It makes me a little self-conscious. Can she do anything to improve that? Maybe we can talk about scarring in general.
Scars in general. And breast reduction's notorious for this. So is bypass surgery in the heart, sometimes tummy tucks, big, thick, red scars. We've got lasers for them. We've got injectable steroids. We've got topical silicone sheeting. Almost, I can say, if you treat the scars aggressively, there's no scar we can't whiten and flatten. So you can, it would be virtually gone, not completely gone? No, you'd always be able to see it. You've got to hide them well as a surgeon, but if they're red, raised, and ropey, we can flatten them and take the red out of them, at least make them more palatable, more tolerable. All right. My 17-year-old daughter has lots of freckles. She hates them. She has looked into getting rid of them. Is there any safe way for her to do this? Ioma? Ioma, I think that is. Often freckles, age spots, sun damage leaves you with unwanted brown on your face, and treatments that are very popular are called photofacials, which treat your entire face, and they blend brown discolorations, freckles, pores, and unwanted blood vessels. And so usually you don't want to eliminate every single defining feature in your face, just blend it. And photofacials are usually the best way to do that.
So that you could get rid of some but not all of the freckles.
Yeah, you can lighten and eliminate, at least fade them into the background.
Okay. Curious as to what goes on in a simple reduction of baby fat in the chin and neck area. What's the cost? What's the time? Is it more or less expensive if there's more work to be done? That's Scott in Toronto.
Men, three biggest things men do: bags under the eyes, double chin and jowls, love handles, and then I guess male boobies. So 4 things.
Oh, Gary.
And under here, usually if you're young enough with good skin tone, it can be done with a little bit of liposuction. With this lipo-light procedure I was talking about, I'm working on a smaller treatment head that works on the neck and the jowl. Yeah.
Oh, okay. So we could melt that away as well.
Yeah,
so if you just have a little something, you can get that removed with lipo.
Yes, lipo is the #1 way that we remove those double chins.
Okay, great. Dr. Mulholland's going to stick around. We've got more questions that we'll answer in just a few minutes. First, here's Kevin.